Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and look who's back for day 2, Jacqueline. Jacqueline served in the Navy, and we really appreciate her service and thank her for her service to our country, as we do all veterans. And Jacqueline has a real interesting history and story about her lumbar spine and lumbosacral radiculopathy, that she's been seeing physicians and physical therapists in the past. And Jacqueline, I'm going to let you take over and just kind of tell them your history with this whole thing, and then how you came to be here and how Tri-West got you in here to see us after you asked them.
When I was active duty, I was seeing several specialists, acupuncturists, physical therapists, ortho specialists, pain management specialists, I mean everybody. And once I got out of the Navy, I started seeing a lot of people with the same, in the same area of expertise, and I got my pain management doctor to refer me over here to help me.
But
because
after,
nothing else has worked. Yeah.
A significant disagreement about it though, right? Because he didn't want to refer to a chiropractor.
No, initially he said it's not something that he normally does, it's not something that he advocates for, and I pushed for it. And so he wrote the referral, and here I am.
Yep, and Tri-West got you over here, even though you're from El Paso. You already had a trip booked here, so you might as well cover it anyway.
Right.
Yep. So let me ask you, you've had 2 adjustments today so far,
right.
Yesterday, and what difference did you notice after your very first adjustment and after your second adjustment, this being your 3rd one this morning?
So the first one, God, that thing was so painful, but I was able to stand up straight. I was able to walk with ease. And after the second one, I was a little sore, but everyone noticed that my posture was better. I was walking with ease. I wasn't compensating as much.
And you didn't have a severe pain and spasm down there that you'd had for a while.
And it was a very strong, dull, very
soreness.
Strong pain. Before it was definitely all my sciatica and my spine.
Yeah, she's still in the first 72 hours of her treatment here, so I expect her to be sore, but I think what she's saying, if I'm reading her right, which I usually do, read patients right, is that the pain that she was feeling has been suppressed, and now she's dealing with a new musculo-ligamentous soreness from the adjustment itself, just for this first 72 hours, which everyone really has to go through that. It's like when you go into the gym and you work out really hard and you haven't worked out in a long time, you're going to get sore that next day and the next day and maybe even the next day after that, depending on your physiology. So, but the one thing about Jacqueline's case that is very intriguing to me, and I got this out of her history, and I kind of stepped back for a couple of minutes on her history, because she told me that the medical doctors had told her that she had a crack and a hole in her spine and was unstable in her spine due to a fracture. Well, we as chiropractors, especially in the state of Texas, we do not treat fractured spines, or any fractures for that matter. And so she had only been told these things by having MRIs done. So what I did yesterday was I went ahead and ordered a series of x-rays on her cervical, thoracic, and lumbosacral spine, and we got those back in here this morning, and we reviewed those already. I'm not going to go over her confidential patient information with you on video. However, what they were calling an instability is something we see here all the time, and that's called anterolisthesis or spondylolisthesis, where the pars has a defect in it. That's the pars interarticularis, which are the facets in the lumbar spine. And that could have been from birth, or it could have been from a hard fall that she had back when she was younger, that you told me about. You landed on your tailbone.
Right, about 5 years ago.
Yeah. And so it can happen from trauma, it can happen from birth, but just because she has an anterolisthesis or a spondylolisthesis, that does not indicate that she should not have this manual y-axis neurodecompression adjustment. In fact, that's the preferred adjustment that I like to do for spondylolisthesis and anterolisthesis, because it lifts the spine straight up and reseats the joints. And if we can reseat the joints down at her L4, L5 area where she has the anterolisthesis, it makes it close the proximity of that pars defect in there, and it takes the pressure off the disc and off the nerves, and that's exactly what's happened this first 24 hours. So we're going to show you how we did that now. Okay. Okay, let's have you flex your head forward and backwards for me. Oh, that's all right. I deal with hair all the time.
Okay.
Yeah, I can still see. Yeah, take a look. No, stop at neutral for me. There, look, you're right down the middle right now. Look at your pelvis right down the middle too. Yeah, you're not tilted so bad. Nope. Okay. Let's come do this one first thing this morning. Yep, we get right to the heart of the matter.
Okay.
You got a front row seat for this ring dinger. And this is Jacqueline's mother, and she can tell you how much she saw her hurting previously and how much better she is after her first 2 adjustments here.
She has stairs in her house. She couldn't even come down the stairs.
Okay, I'll get it in sideways. There you go. That's it. I know that's tight, but I like to get your pelvis in there tight so I can get a better pull.
Okay.
Just breathe. I still only got 1 hit on my trophy ball bone.
I remember that.
Okay, there we go. All right, nice, easy. There, so that's perfect. So see, I'm doing a straight y-axis adjustment on her, which lifts and separates and then reseats all 24 freely movable vertebrae in her spine, and she felt that all the way down to L5, I know. There you go.
That one wasn't as bad.
It gets easier, it really does. Well, now we've got the scar tissue and adhesions broke loose, I'm getting a deeper pull on you. Did you notice that?
Yeah, that was so much easier than the first one.
Oh yeah. I remember the first one brought tears to your eyes. Yeah. Okay, let me help you up sideways here. Or almost.
No,
you're Navy
No,
veteran, so you don't get that many tears.
No.
And if they are, they're salt water, right? Yep. You know, I really want to applaud Jacqueline and other veterans who seek natural, drug-free, surgery-free chiropractic care for their biomechanical spine issues, because, you know, she's been offered a whole host of drugs through her physicians, and they also wanted to do injections, and if that didn't work, surgery. So they have their own agendas for that kind of stuff. So I really applaud Jacqueline for making the correct choices, as well as the VA for making the referrals and getting her here. And I also want to thank her pain management doctor out there in El Paso for getting on the phone and talking to me yesterday, because I wanted to talk to him personally before I even accepted Jacqueline as a patient. Yep. Okay, breathe. There. Making me work for him this morning, aren't you? Legs are even. You shouldn't really have any pain there, but do you?
No.
Okay, good.
And the first one, I felt a lot of pull. There's no resistance.
So she also has a loss of the normal cervical lordosis, which I'm adjusting on the Z-axis, P to A. Let's turn you on your back now. So we're helping get the curve back in her cervical spine, her lumbar spine, and correct her biomechanics 3-dimensionally on the X, Y, Z axes. And look here, she's only been here a couple times. She already knows what to do. Just like that. Plus, you watched a bunch of our videos too before you came, huh? Slide down just about another inch. There you go. Okay. Her AC joints in her shoulders, her clavicle where it attaches to the sternum, and then the anterior costosternal joints right here. There you go. You can relax your hands on your tummy. Atta girl. You should have felt that from your knee all the way up to your lower back.
Yes.
Okay. Yeah, let me have this one too. Atta girl. Yes, ma'am. Okay, let's sit you face towards your mom there. Alright. Well, look at her just sitting right straight up. A little crappy to sit in it. Yeah, moving a lot faster actually. And what are you going to do when you leave here?
I said.
Yeah. And what else?
Stretch a little.
Walk. Brisk walk for 10 minutes.
Around the...
Letting your arms swing freely so we can reintegrate your cerebellum with the rest of your body's kinetics.
Try and lift 100-pound weights because that's what she wants to do.
I know, but you know what? I'm not going to tell her that. As long as she keeps good mechanics, you go work out and do whatever you want.
That's right.
I'm serious.
I'm so afraid of her getting injured again.
No, I'm serious.
I'm just going to have to listen to my doctor.
Yeah, you got her for the first half of her life. Now I can straighten her out. You straighten her out for the first part of her life. Now I get you. Okay, let's see if I'm going to shoot you now. So this is a new instrument that I got, but it's not new to me because I've been doing it for a long time. So I'm just going to stretch her. At the same time, I'm going to bounce her muscle spindles in her trapezius muscle all the way down to its attachment here in the lower thoracic upper lumbar spine. And I'm just going to relax the paraspinals here in her lumbar spine as well. And look how much you've increased that range of motion in her neck already. Okay, now let's pull your shoulders up and back for this one. And come straight back here. No, we're going to come back this way first and then like this. And I'm going to adjust her atlas on the x-axis. There you go, good. Okay. Now let's try that same movement again. You tell me if this feels any different to you this time.
No.
Smoother?
Mm-hmm.
Yep. You know,
it's easier.
For all you guys that don't think that instrument does anything, tell them what that instrument did for you, Jacqueline.
Oh my God.
It relaxes the muscles, doesn't it?
It like needs it.
Yes, it does. And when I adjust your atlas, it reconfigures your cerebellum and the communication it has with your body to start holding you in a better biomechanical configuration. Good. So, is there anything else you'd like to share with our fellow veterans, your fellow veterans? Or the VA about doing research on this technique to make sure that people are getting the best drug-free, non-surgical
If you've never
care?
considered a chiropractor, which I never did, I never even believed in them. And this has been what I've been trying to achieve for the past 3 years.
So it's life-changing, really.
I've not been able to find relief in 3 years.
Praise the Lord. I'm happy for you.
So, yeah, absolutely.
And again, we want to thank the VA and Tri-West for referring her here, and the Veterans Administration for doing research on this technique to allow more veterans like Jacqueline to get natural, drug-free, surgery-free chiropractic care in the future. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.